All right. Thanks. Okay, so we will go ahead and get started. Just want to say a huge thank you to ASM, to Mark and to Amanda for hosting us and allowing us this wonderful space. We truly appreciate it and hope you can connect with them after the talk. And as well, always am forever grateful for the One Health Commission support via the webinar. For those of you that are tuned in online, thank you for joining us. And we couldn't do this or share this with you without the One Health Commission support. So we encourage you to support them and check out their information on the site, on the slide here at that website in order to help them continue to do their good work. So thank you to both organizations. And now, without further ado, Casey Barton Behravesh is a captain at the U.S. Public Health Service and is director of CDC's One Health Office and the National Center for Emerging and Zoonotic Infectious Diseases. Dr. Barton Behravesh is a veterinary epidemiologist and has extensive experience investigating outbreaks and conducting epidemiologic research related to foodborne, zoonotic, and vector-borne diseases. She currently serves as the CDC focal point for implementing an interdisciplinary One Health approach connecting human, animal, and environmental health to address emerging zoonotic and infectious disease in order to best protect public health. She has extensive experience bridging the gap between human and animal health officials at the local, state, and federal levels, as well as global, related to emerging zoonotic and infectious diseases. She enjoys mentoring students and new CDC staff and serves as a passionate supporter of the important role of veterinarians in all public health work. Dr. Barton Behravesh trained as an epidemic intelligence service assigned to work on foodborne and zoonotic disease at the CDC. She is a diplomat of the American College of Veterinary Preventive Medicine and has been the recipient of numerous awards, including CDC's James H. Steele Award for outstanding work on veterinary public health issues. I'm sure all of you are as excited as I am to welcome Dr. Casey Barton Behravesh to the stage here. Thank you so much for coming.
Hi, good evening, everyone. It's nice to see so many familiar faces in the room, and thank you for those joining through the webinar. I'm really excited to be here to talk about One Health in action at the Centers for Disease Control and Prevention and the work we're doing globally in the United States, as well as in a unique area we're working on preventing pet zoonoses. But to get us started, I want to say the health of humans is connected to the health of animals and the environment. It's important for our food supply, for the production of fiber, sport, entertainment, and travel, and also companionship and the importance of the human-animal bond. I'm sure many of you have pets at home or have had pets that have been important in your lives. So those connections are very close and very important regardless of what area it's in. So to address these close connections, a One Health approach is critical. When we're talking about One Health, we mean the people who protect human, animal, and environmental health, as well as other relevant partners who are working together, coordinating, collaborating, and communicating on a shared topic, all with the goal of achieving the best health outcomes for people, animals, plants, and our shared environment. So we have this new infographic from CDC to kind of illustrate the concept of One Health. I also want to say it's very important to talk about One Health in a consistent way. It's been really exciting to see how One Health is really gaining momentum all around the world, and to help people better understand what we're talking about, we've come up with a definition that multiple agencies and partners were involved with creating and kind of updating from some of the original One Health definitions. And the key to this is One Health is a collaborative effort of multiple disciplines and sectors working with the goal of achieving optimal health outcomes, recognizing that interconnection between people, animals, plants, and our shared environment. And it applies at all levels, whether you're working locally, nationally, regionally, or globally. And the example I always give is people say, CDC's a One Health agency. We are a partner in One Health. We're a multidisciplinary agency. We have physicians, veterinarians, scientists, lawyers, laboratorians, engineers, and many other disciplines relevant to One Health. But we're not doing One Health work if we're not working with the other sectors, so our animal health partners and our environmental health partners. So that's why it's important to talk about One Health as multidisciplinary and multisectoral. So again, many different disciplines involved in One Health, and I'm really excited after the introductions in this room to hear the really diverse audience. I think this is one of the most diverse One Health crowds I've been in recently, so that's really great. One Health is a team sport, and partners are key in that. There's no one person or one sector or one agency who can do One Health work alone. So that's something that's really important to mention when talking about One Health. So as I said, CDC is a One Health partner. I want to talk a little bit about what our agency's role is. We work 24/7, sometimes literally, to protect America from health, safety, and security threats, whether they're foreign or in the United States. And then whether those diseases start at home or abroad, whether they're chronic or acute, if they're curable or preventable, if it's caused by human error or deliberate attack, we fight those diseases and support communities and citizens to do the same. And in order to accomplish CDC's mission, we conduct critical science and provide health information to protect our nation against these often expensive and dangerous health threats, and of course, responding when they arise. So CDC has facilities in 11 US locations. We have more than 12,000 employees in nearly 150 different occupations. We have field staff working in all 50 states, in DC and Guam, Puerto Rico, the US Virgin Islands, and more than 120 countries around the world. And this is our organizational chart. We're made up of many different centers and offices. So there's a number of One Health topics covered across CDC. People often think of zoonotic diseases when they think of One Health, but there are a number of issues related to emerging infectious diseases, antimicrobial resistance, food safety, vector-borne, parasitic diseases, influenza, respiratory viruses, tuberculosis, but also areas like global health, pandemic preparedness, environmental health, looking at surveillance, laboratory animal medicine, occupational health are important One Health issues. We've been involved with CDC One Health work around obesity, around the opioid crisis, and mental health, and even workforce training. So there's a broad array of One Health topics all across the agency. But for the purposes of this talk, I want to focus in on emerging and zoonotic diseases, or those spread between animals and people. They can go both ways. So zoonotic diseases are important because they're a threat to health security. We know that 60% of existing human infectious diseases are zoonotic. At least 70% of those emerging infectious diseases have an animal origin. Of the 5 new human diseases that appear every year, 3 of those are of animal origin, and 80% of agents with potential bioterrorist use are zoonotic pathogens. And there are many different impacts of zoonotic diseases. It's a public health problem. It can result in reduced animal production capacity, leading to food safety concerns or obstacles to international trade. Again, the bioterrorism potential. There could be negative implications for environmental health, economic losses, impacts to mental health, and many more. So at CDC, we're made up of different centers, and one of the centers I want to highlight is our National Center for Emerging and Zoonotic Infectious Diseases. That's the center where I work. Our mission is to reduce illness and death associated with emerging and zoonotic infectious diseases, and to protect against the unintentional or international spread of infectious diseases. There are a number of focus areas that I'm going to highlight from our center's work, and you can read more in our strategic plan that's available online. Our work, especially our One Health work, often makes the headlines, whether we're talking about foodborne diseases or West Nile or brain-eating amoebas or many other things. There's frequent headlines from our center's work. Outbreak investigations is one of those. 1 in 6 people in this room will get food poisoning in the next year. It's a big issue, and not only do we do surveillance for these types of diseases and antimicrobial resistance that can be associated with them, we investigate outbreaks to figure out what we can do to prevent illnesses, what caused the outbreak, but also what went wrong to prevent future similar outbreaks from occurring. So that's an important role of CDC in noticing trends in what types of foods are causing outbreaks, not just traditional meat, dairy, and eggs like many people think, but a lot of produce and processed foods, as well as pet products causing outbreaks of human illness. I want to highlight a new antimicrobial resistance challenge that the U.S. government is spearheading. It's a year-long initiative that's bolstering efforts across sectors and around the world to step up, partner, and play our part in the fight against AMR. This is really important, and there's information available online. They're accepting new commitments through September 2019, and they have some really great partners and commitments from all around the world, from the livestock sector, the pet industry, from public health partners, and many others. So I encourage you to check that out or contact this email if you're interested in more information. Not all of our work's related to zoonotic diseases. We have the One Health Harmful Algal Bloom System, or OHABs as we call it. Harmful algal blooms can contaminate the environment, drinking water, recreational water, and food. It can cause illness in people, but also in some animals, especially cattle and dogs. And there's a surveillance system that collects information to help better understand what's happening with these illnesses and how to prevent them. It's voluntary, and information from public health departments, environmental health, or animal health partners are all ending up in one surveillance system. So you can look at data across those different sectors and maybe find problems before it spreads wider. So a really exciting One Health surveillance system to highlight as an example. There's also work on vector-borne diseases at CDC, and one thing I want to highlight is fighting tick-borne diseases. Rocky Mountain spotted fever is a deadly tick-borne disease. The death can be as horrible as dying from Ebola. The average time from when you get infected by a tick bite until the time you could be critically ill is only 8 days, and often the diagnostic tests take longer than that. So it's very important to get doxycycline on board right away for patients of all ages. And there's been a big emergence of this deadly disease out in the tribal lands in Arizona. And CDC veterinarians and epidemiologists and other One Health partners work together to create what's called the Rocky Mountain Spotted Fever Rodeo. And this is a very successful example of a One Health prevention project showing that human health can be improved by addressing animal and environmental health. So what they did is dogs and ticks that feed on dogs were helping to spread Rocky Mountain spotted fever in the environment and to people. So they applied long-lasting tick collars on all dogs, taught the tribal residents about dog husbandry and welfare, did appropriate environmental tick control where they had yard treatments at appropriate times of the year and did a big campaign 4 times a year, and did health education to the community to get to seek medical care quickly if they develop these symptoms or if they've been bit by a tick and develop a fever, for example, and also for the healthcare providers to get that doxycycline on board. And they made significant progress in reducing illnesses through this One Health prevention project. I also want to highlight One Health work at CDC's Arctic Investigations Program based out of Anchorage, Alaska. There's an Alaska One Health group where the AIP program co-leads it with Alaska Native Tribal Health organizations, and they have regular meetings on One Health topics. There's also a movement on operationalizing One Health in the Arctic, where there are multiple countries and they're working to create One Health hubs in each of those nations as a point of contact and exchange of information. And then there's a really cool local environmental observers network where citizen scientists, science network in remote villages use a smartphone app and a website to report environmental changes, and then the people who manage this network can track problems and find trends in places where they might not be going regularly. Then I want to highlight a project we have, another One Health project, Influenza and Zoonoses education among youth in agriculture. With the emergence of novel influenza viruses linked to swine, and the recognition that there are many youth showing swine and other animals at agricultural fairs through youth organizations like 4-H or FFA, and leading to the recognition that there's a real opportunity to educate youth on the prevention of zoonoses, how to stay safe and healthy around their animals, and bringing in state health departments, youth extension partners, and state departments of agriculture to work together on a fun project where they're working to educate youth. We've seen the side effects that they're forming these trusted One Health partnerships during a fun, calm project, a non-emergency project. And whenever an emergency happens with a zoonotic outbreak, they're able to work together more rapidly and respond quicker by having those trusted partnerships in place. So a really another exciting example of One Health in action. So I want to highlight some different work. Here's one. We've seen a growing problem over time with people getting sick from backyard poultry. There have been over 4,700 illnesses, almost 900 hospitalizations, and 7 documented deaths since 2000. It's been a growing problem, and through One Health efforts of working with public health officials, animal health officials, environmental health partners, doing sampling at farms, figuring out where the problems are coming from, and really making a difference in eliminating some of these strains of salmonella that are making people sick. Also, through some of this work, leading to policy changes that are helping the industry be able to track problems and identify problems, hopefully before they get to the point of causing an outbreak. There's also been a recent multi-state outbreak of Seoul virus, which is a type of hantavirus linked to pet rats. So this was a surprise in the United States where multiple people were getting Seoul virus, something that wasn't really seen here before, from pet rats. And these were pet rats bred as more of a hobbyist or small mom and pop operation in people's basements type of thing. And we learned it was critically important to work with partners in the absence of regulation over these animals in a disease like Seoul virus. We work closely with our partners in the pet industry to be able to work with the breeders and develop some recommendations and practices to prevent these illnesses. Here's some of my colleagues, some disease ecologists and a veterinary epidemiologist going into the python cave in Uganda on the hunt for Marburg virus. So the giant pythons and cobras they had to walk through in the bottom of the cave weren't the most concerning thing in there. It was the Marburg virus, which is a cousin of Ebola virus. There's Rift Valley fever virus vaccine work as a great example of preventing disease in humans and livestock, and the importance of vaccinating animals as a way to help protect human health with the disease like Rift Valley fever that has a human, an animal, and a vector-borne component. There's also been work discovering new pathogens. Here's an example of One Health in action where a new orthopox virus was found in the Republic of Georgia, and one of our CDC physicians doing some animal sampling out there, looking at the ecology aspect of things. Also work on emerging infections like East Respiratory Syndrome, coronavirus or MERS, and doing some work in the Middle East looking at camel slaughter and the relation between camels and this virus. And then another emerging infectious diseases example, this is one of our colleagues, Stephanie Salyer, who works in the One Health office, doing a Zika virus ecology study in Peru as part of her global health activities. And there she's holding a bat that she's sampling. This is Dr. Julie Sinclair, who also works in the One Health office, and this is an example of some important partners that we have on the global front. She serves as our liaison to the World Organization for Animal Health, or OIE, and is very active in promoting global health security through Global Health Security Agenda, supporting joint external evaluation processes, which bring together multisectoral and One Health players to assess where a country's at and where they need to go for capacity building. And then I'm sure everyone in this room is familiar with the West Africa Ebola outbreak and that important health crisis we faced. And I want to highlight a kind of unique piece of that outbreak that isn't talked about. And that is what I say, the power of the pet. One of the nurses who was in Texas and became ill after treating a traveler from an Ebola-affected country developed Ebola herself. She had a pet dog, and there was one study published that dogs in Africa during an Ebola outbreak where they were sampled had antibodies to Ebola, antibodies. And also, by the way, 2% of control dogs in France also had antibodies. What did this mean? That's all the information we had to go on. There's a lot of fear and panic out there around Ebola. And so we had to not only rapidly come up with a plan of how to handle this dog and be able to decontaminate the owner's premises, care for the dog, test the dog for Ebola, show that it did not have Ebola. That's a whole separate hour lecture in itself. But the point of this is the power of the pet. We were able to eventually reunite this dog with the owner. And the owner said while she was fighting for her life in quarantine, being treated for Ebola virus, the one thing that kept her going was the veterinarians at Texas A&M who were taking care of this dog, sending her updates and pictures every day. She said it was her best friend, and it really helped with her mental health aspect of things while she was there. So I wanted to highlight that as an example. Now I want to turn our attention to, now that I've highlighted several One Health activities across CDC, I want to share what we're doing in the One Health office. So we work with the mission of achieving optimal health outcomes for people and animals living in our shared environment. We focus on zoonotic and emerging infectious diseases, influenza and pandemic preparedness. We frequently get involved in One Health issues and emergencies at the human-animal environment interface. We're very involved in global health security, work advancing One Health in the US and globally, and then preventing zoonoses shared between people and pets. And as I said, there's increasing global attention on One Health, and I want to highlight our global One Health work first. We provide technical assistance on One Health, the implementation of One Health, as well as specific One Health topics to countries. And over the last few years, we've provided support to just over 20 countries. We partner with key global organizations and provide technical assistance to partners like the World Health Organization, the US Agency for International Development. We work very closely with the Food and Agricultural Organization of the UN, our FAO, and the World Organization for Animal Health, or OIE. And we actually have One Health liaisons or loaned experts who are, their time is dedicated to working with those organizations and building those One Health bridges around our global health security work. At CDC, the One Health office also serves as the head of an OIE collaborating center for emerging and re-emerging zoonotic diseases, so we can help support OIE in that important area and work with different partners and meet their member country needs as well. We support global health security activities, and we lead CDC's One Health zoonotic disease prioritization process. So that's just some highlights from our global work. And I want to kind of delve into our One Health zoonotic disease prioritization process just a little bit to give you the flavor of what's going on with zoonoses around the world. So we have this great tool we developed at CDC that helps bring all the partners in a country together from the human, animal, and environmental health sectors, as well as their collaborators, often from academia or international organizations, to use a transparent and equal process to prioritize their top zoonotic diseases of greatest national concern that they want to collaborate on using a One Health approach. It gets everyone into the same room. They have developed joint priorities. The tool is customized to each country's needs. It's not a cookie cutter approach. So something that works in Pakistan, for example, might not work in Sierra Leone. So we recognize that and have this great tool that has really allowed for all the One Health players to come together in a country so they can make plans to focus their limited financial and personnel resources on advancing One Health around the priority zoonotic diseases. We've done this now in 21 countries around the world, including the United States. I'll come back to that in a moment. We actually have a big workshop coming up in West Africa where we're doing our first regional workshop for the 15 countries that fall under the Economic Communities of West Africa, or ECOWAS. So we're very excited about that. So this is what everyone wants to know. What are the most commonly prioritized zoonotic diseases around the world? Well, based on data from these 20 countries, rabies is #1, followed by zoonotic influenza viruses, viral hemorrhagic fevers like Ebola, Marburg, and Rift Valley fever, especially across Africa, anthrax, brucellosis, and we're seeing more and more countries prioritizing zoonotic tuberculosis. If you're interested in this work, you can go to our website. We have reports from the countries that detail the process and give you information on their priority zoonoses, as well as next steps and action plans to address those. And here are some highlights from some of the common needs that have been identified from countries in addressing their priority zoonoses, advancing global health security. #1 is they want to improve One Health coordination and have formal mechanisms in place to be able to do this. They want to improve data sharing across human, animal, and environmental health ministries and partners. They want to increase surveillance and outbreak response capacity and use a One Health approach for that. They've talked about developing disease-specific subcommittees and technical working groups for each of the priority zoonoses. There's always talk and recognition of the importance of strengthening the One Health workforce, and a lot of talk around improving communication, including to the public. And here's a reference here if you want to read more about that. So one example I want to show is from Pakistan, and Kate actually has been involved in some of this work. So this is linking One Health activities in Pakistan. They did a One Health zoonotic disease prioritization workshop. It's important to say Pakistan's a country where they're very active in One Health. There was a lot of political support around One Health before they did this workshop. They had a follow-on activity where they wanted to develop a One Health framework and strategic plan that included a focus on their priority zoonotic diseases. They had special breakout sessions for some of their priority diseases, including rabies and brucellosis. And they even had One Health participation, not just from the national level, but also the provincial levels. And they were able to draft a strategic plan that focuses on reducing the burden of their priority zoonoses, preventing and effectively responding to outbreaks in Pakistan, and made a 5-year plan. They're working to finalize that plan, get it endorsed and approved by all the partners, and to implement the plan. So really exciting things that come on after the One Health zoonotic disease prioritization workshops that tie into a lot of other activities going on with many of our other partners. So just to highlight some of those, we've worked with USAID in their National One Health platform activities. They're supporting a number of countries under the Global Health Security Agenda in formalizing those One Health coordination mechanisms and working with those partners to have those mechanisms host and manage the One Health zoonotic disease prioritization workshop. We've worked with partners at the University of Minnesota and USDA on the One Health Systems Mapping and Analysis Resource Toolkit as a follow-on to our One Health zoonotic disease prioritization activities to further assess systems and identify gaps in those systems. The prioritization activities have benefited either preparation for JEEs or follow-on activities for JEEs, and also working with the Tripartite partners on a number of other One Health tools and activities that they have going on in this realm. So it's been really exciting to see how all of this can kind of fit together and what One Health pathways look like in countries. So also recognizing needs from these country workshops and where the gaps are in terms of where capacity building needs are. There's been an initiative to start a project with the FAO-OIE-WHO Tripartite. It's called Taking a Multisectoral One Health Approach to Prevent Zoonotic Diseases in Countries. It's updating a regional specific guide that was created in 2008 to make it applicable globally to a variety of zoonotic diseases, as well as other One Health issues like AMR and food safety. It covers 7 main topic areas, is going to include highlights from country experiences and lessons learned. And as a follow-on phase, once this guide comes out shortly after the new year, there's development of operational tools and toolkits, including for developing multisectoral coordination mechanisms, joint risk assessment for specific threats, and surveillance and information sharing as some examples. And so this has been coordinated by the Tripartite with the global One Health partners being engaged. It's going to be applicable to all countries and regions and all zoonotic diseases, and it's going to be translated into 6 UN languages. It'll be available soon. Also, we have work going on recognizing the needs around surveillance to create a One Health pathway for zoonoses surveillance for some of the most commonly prioritized diseases. So we have this detailed graphic here as an example representing rabies and how things might happen from an event to the response, and then the varying levels at the subnational, national, international, and even community levels, and the different role of human, animal, environmental health partners. And we have a project on this looking at some of the most commonly prioritized zoonotic diseases to give countries an idea of how One Health surveillance should work. Now I want to turn our attention to our One Health work in the United States. We're working very hard to advance One Health in this country. We've prioritized zoonotic diseases at the national level. We're working to develop a national One Health framework. I will talk about that in a moment. We're coordinating our One Health federal interagency network that we call OFIN. We actually had a meeting earlier today hosted at the EPA, and it's a way to bring together federal partners to exchange information and updates on One Health and look for areas where we might be able to network. And so we're really excited about that as a way to keep federal partners connected. We also partner with key state and federal organizations. I talked about the Youth in Agriculture Project as an example already. We also manage CDC's unique partnerships with veterinary medical, animal health, and environmental groups. I'll talk about some of those in a moment. We distribute education on zoonoses and One Health topics to our stakeholders through things like our Zoonoses and One Health updates or ZOHU calls. How many have heard of our ZOHU calls? All right, a good number, great. And through also our website, social media, and other communication avenues. So in the United States in May of 2016, we underwent a joint external evaluation, and I wanted to show the results specific to zoonotic diseases here and show that we have some room for improvement. Scores are typically on a 1 to 4 scale. We received a 3 in surveillance systems being in place for priority zoonotic diseases and pathogens. At the time, we didn't have a priority zoonotic disease list agreed upon by all the relevant sectors. And also they recommended that we needed to take a national approach for One Health to formally address One Health and formalize those interagency networks, as well as some workforce gaps. You can read the full report here. There's a lot of great information in there. So because of that and recognizing some of those gaps, we talked with our partners at the Department of Interior and USDA as kind of the 3 federal leads for zoonotic diseases, and decided to collaborate to use a One Health approach to prioritize zoonotic diseases of greatest national concern in the United States. This was held at ASPR headquarters in Washington, D.C. last December, and we had 2 goals with this workshop: to prioritize the zoonotic diseases and also develop plans for implementing and strengthening our One Health approaches to address those diseases in the United States. That was a picture of the workshop participants. You can see there are many different departments and agencies represented, and we had state voices from agriculture, public health, and wildlife as well participating in these discussions. So this is the priority list. We ended up with 8. We normally recommend 5, but we ended up with 8 for the United States. You'll see it's a mix of endemic and emerging zoonotic diseases, things like zoonotic influenza viruses, food safety issues like salmonella, vector-borne diseases like West Nile virus, plague as well, an important wildlife health issue, emerging coronaviruses, rabies, brucellosis, and Lyme disease. And we recognize some key themes and needs for the United States that are similar to what we saw globally, but specifically for the US, we recognize the need to have a formal One Health coordination mechanism, including at the leadership level and technical levels. The importance of having leadership engagement in One Health and it not just being down in the technical levels was a big gap that we recognize. That we would benefit from having a national One Health framework developed for the country. There are many opportunities for improving collaboration and communication, for surveillance and data sharing, for strengthening joint outbreak investigations, especially for the priority zoonoses, better coordinating education outreach efforts around those priority zoonoses, as well as to have a joint discussion on research needs. So the National One Health Framework is very much draft, all capital red draft, under development, and there will be a movement to get more partners involved in it soon after the new year. But it's for a 5-year time frame. It's intended to guide U.S. government One Health collaborations and to describe a common vision and common goals, not to be a detailed plan of all One Health activities in the U.S. It'll help to define roles and responsibilities of key federal partners. The development's being led by CDC in partnership with USDA and Department of Interior. And we have draft goals around One Health collaboration in areas like communication, coordination, prevention, preparedness, joint outbreak response and recovery, surveillance lab, antibiotic resistance and workforce. So the priority zoonoses will be incorporated in here, but it won't just be limited to the priority zoonoses. More to come on that. So the last area I want to talk about our One Health work is our zoonotic outbreaks, especially related to pets. We're seeing them more and more frequently in the United States. We're seeing that the more you ask about it, the more you'll find them. We've long known about problems like salmonella in tiny turtles, so much so there's a ban on the sale of turtles with a shell length of under 4 inches. That's almost the same age as I am. We've been seeing a growing trend in the backyard flock associated salmonellosis, different diseases around pet rodents, whether it's a hamster, a mouse, a rat, or a gerbil or a guinea pig, things like salmonella, lymphocytic choriomeningitis virus, rat bite fever, Seoul virus, and others. We've seen influenza in cats at a shelter. Influenza was determined to be a bird strain of influenza that ended up in cats and got at least one caretaker of those cats sick. And of course, petting zoo issues. And then also a recent multi-drug resistant Campylobacter outbreak in people linked to pet store puppies. So very diverse things happening across our companion animals. So some things we learned that I want to highlight to explain why we are doing what we do are pets can appear healthy and clean, but be carrying germs that can make people sick. People do not have to touch a pet to catch a zoonotic disease. I can't tell you how many stories of infants I've seen that have ended up hospitalized with a bloodstream infection of something like salmonella because of cross-contamination in the kitchen sink, just cleaning out that reptile tank or handling pet food and then handling baby bottles and things like that. So you don't have to touch a pet to get sick. That's important. It applies to the petting zoo outbreaks as well. Also, as I believe, there's a right pet out there for everyone, but not all pets are right for all people. There's some higher risk people, whether they're people over 65, young children, or people with weakened immune systems. So it's important to find the right pet that not only matches best with your health, but also your lifestyle. And so we are working to fill a national void around preventing zoonoses shared between people and pets. We provide the One Health expertise and support during outbreaks and emergencies involving pets. We've been called into issues like hurricane responses and other disasters with the pet piece in mind. We partner with the pet industry, with professional organizations and others. I want to highlight our partnership with the Pet Industry Joint Advisory Council. In the absence of any regulation on many of these pet-related issues, we can work with our industry partners to try to help figure out what went wrong and prevent future similar outbreaks and share important prevention messages across industry partners as well. We work to prevent zoonotic diseases through evidence-based activities, and I'll show an example of that in a moment. And we distribute zoonoses prevention messaging and One Health updates to stakeholders. And a big way we do that is through our Healthy Pets, Healthy People website. Despite the name, it covers zoonoses spread between people and pets, livestock, and wildlife, so all animals. And it's actually been used as a global resource. It's in CDC's top 100 most popular websites, which we're really excited about. And we have some great information on enjoying pets without getting sick, information linked there on outbreaks. So I encourage you to check it out. There's some flyers at the back of the room for those who are here. One of the examples I talked about on our evidence-based messaging, we work with the National Association of State Public Health Veterinarians and support the development of compendia guidance. Here's one I want to highlight. This is something that was created after recognizing a growing trend in outbreaks of children becoming ill after visiting petting zoos. So this is our compendium of measures to prevent diseases associated with animals in public settings. And it's a great resource for people who might have animal exhibits, zoos and fairs who might host animal exhibits, veterinarians who might be taking care of animal exhibits, public health officials who are doing those investigations, and a variety of One Health partners. And I just want to highlight this example of a prevention signage included in there. And I was recently at an apple orchard with my kids in North Georgia, and they actually painted the sign on plywood and had it outside the petting zoo. It was so exciting. So just to highlight those examples and how they're being used. And then again, I just want to say it's important. We don't want people to be afraid of pets. We don't want people to get rid of their pets. We don't want people dumping pets outside and causing environmental health issues like with invasive species, like red-eared slider turtles, for example. We want people to know the simple things they can do to enjoy their pets without getting sick. So I just want to close with saying One Health is the way forward to best protect health for all of us. Hopefully you have an idea of One Health in action across CDC and what the One Health office is specifically doing for global health, domestic One Health, as well as preventing pet zoonoses. And we think it's really important for all of us to work together to have strong collaborations and partnerships so we can really have the biggest possible impact on improving health outcomes for people and animals in our shared environment. And at the back of the room, we have some handouts. They're also available online for people who are in the webinar. Our One Health Office fact sheet. I want to invite all of you to join the distribution list for our Zoonoses and One Health updates call. It happens once a month. We have continuing education available for a variety of professionals. We have over 9,500 people and growing every day representing all sorts of One Health partners on our distribution list. And we encourage you to suggest presentation topics or even volunteer to present. You can go to our website for more information and also see past recordings of calls. There are different ways you can connect with us through Twitter, Facebook, Instagram, and also we have a Gov delivery service. You can just put in your email and get a few updates from us each month on timely One Health topics. So I just want to thank everyone. We have many great partners all around the world, and my fantastic staff in the One Health office. This work would not be possible without them. And thank you all for having us here to talk about One Health in action at the CDC.
That was amazing. As a sign of our gratitude from the One Health Academy, we'd like to present you a flag that was flown over the Capitol.
Oh,
it's our tradition. So
thank you.
Please enjoy that. Thank you for coming and sharing all this amazing information with us.
Thank you very much.
Yeah, absolutely. And we'll go ahead with questions now. All that I'll ask is if you don't mind repeating it for the webinar. So any questions for Casey? Oh.
Now the hands go up.
Thank you so much for the overview. I really appreciate it. My name's Rachel. I'm with AHI. My question is, can you tell me a little bit more about your technical assistance and what the One Health Office is doing with WHO and perhaps even with the CDC liaisons to FAO and OIE, kind of what some of the priorities and activities are there?
Sure, thank you. So the question is, what sort of technical assistance and work are we doing with WHO, as well as what our One Health liaisons are doing at FAO and OIE? So a big focus of our work, especially with WHO, is on zoonotic diseases and the Tripartite Zoonoses guide that I mentioned. Our liaisons are involved with a variety of issues related to emerging and zoonotic infectious diseases, antimicrobial resistance, influenza, supporting workforce efforts, modeling a program for veterinarians and animal health staff patterned after some of our successful programs around training multidisciplinary groups of public health professionals through the field epidemiology training program, and a number of really exciting activities around that. Yes.
Bill Lyerly. Thank you very much. An awful lot of information in, I think it was 3 or 4 breaths. The British Army, by doctrine, no longer uses the term lessons learned. they use the term lessons identified, because we tend to identify lessons over and over and over again, but don't really incorporate them. In the field, we often had a saying that everyone wants coordination, but no one wants to be coordinated. Do you have any lessons that come from your experiences as to ways to, and I also used to use, even though I'm not a veterinarian, I use an animal metaphor. You can take a horse to water, but you can't make it drink, but you can heavily salt its feed bag. We get in the feed bag salting business sometimes. And are there any lessons that you've learned in terms of increasing coordination and collaboration between disparate disciplines?
Sure. So the question is, are there any lessons learned or identified on how we can increase coordination across very different disciplines and sectors? And one of the most important lessons, and a surprisingly easy thing, is once you lock people in a room together for several days, focusing on a topic of common interest, people really walk away with an understanding of why everyone's in the room, what the roles and responsibilities are, why they're all locked in that room together, and what they need to do moving forward. And I think that's one of the most important things, whether we're working globally, whether we're working in the United States, whether we're working on some of our pet industry issues, is not just coordinating, but making plans to collaborate and communicate as kind of the foundation for our big lessons identified.
So I guess One Health is that three-legged stool between animal health and human health and environmental health. And I guess maybe my ignorant opinion is that environmental health is often the one that's most ignored or left out. Can you just let me know what CDC is doing with partners on the environmental health side?
Sure. So the question is recognizing the three areas: human, animal, and environmental health. What is CDC doing around the environmental health side? We actually have a lot of great work going on around emerging and zoonotic infectious diseases on the ecology aspect of things, working with different partners on vector control issues and the relationship to the environment. A lot of work being done on safe water, whether it's drinking water, water to swim in, lakes, and looking at some of those connections between human, animal, and environmental health there. On our global front, we have had a big movement with our One Health zoonotic disease prioritization efforts to include environmental health and wildlife health partners. And it's been really great locking them all in the room together and having them talk about issues and really seeing the need to work together across those sectors in some of the countries where we're working, as some examples. We also have a National Center for Environmental Health at CDC that is involved in a number of issues related to water, air quality, and other environmental health issues as well.
Yeah, Bob Bachta, I was just curious, could you speak to CDC and your office's experience in terms of how to control scenarios? I'm thinking in terms of harmful algal bloom, I'm thinking in terms of infectious diseases that are running rampant. What kind of authorities do you have, and how do you implement those, and what might that experience be?
So the question is around CDC's experience and authorities to control some of these One Health threats that we were highlighting in the talk. I think it's important to highlight CDC is not a regulatory agency. There's a tiny piece of regulatory authority that we have related to the import of non-human primates and selected other animals or animal products, for example. But for the most part, we are not a regulatory agency. We work with partners at regulatory agencies as well as other partners, like the example I gave with the pet industry and the absence of regulation over companion animals. To each situation's different. You need to figure out who you need to coordinate and collaborate and communicate with and when, and bring people to the conversation to best address these shared health threats.
I'll still be learning. One question that I often think, for the past 10 years, I have the role of private sector. And we often, especially in government circles, we talk to each other, but we don't bring in the private sector as much as we perhaps could. And even the for-profit sector, we're finding more and more collaboration and coordination. Could you speak to that with respect to your One Health experiences?
Sure. The question is, how do we work with the private sector with respect to One Health? And we have a number of public-private partnerships at CDC. One of them that I highlighted in my talk is our work with the pet industry, and specifically the Pet Industry Joint Advisory Council on disseminating evidence-based messages, our public health messages from CDC to partners, to industry, to pet owners, et cetera, to hopefully really make a difference there. There are a number of different public-private partnerships going on at CDC. There's a website dedicated to highlighting those and showing some success stories from those partnerships. I'd encourage you to check out for more information.
Hi, I'm Emily. Kind of along those lines a little bit, what is the role of CDC and in working with faith-based organizations? I think of, or even just churches in general, but I think of the difference that some faith leaders have been making with female genital mutilation, for instance, and how much that's made such a difference. And what has CDC been doing for One Health? What are the plans, if any, when it comes to working with faith-based institutions?
So the question is, what type of work is CDC doing with faith-based institutions? There have been some activities. I have not been involved with those directly to be able to speak to those, but you might be able to find more information on our website.
I'll wrap up with one more question.
Yeah, this is probably a question where angels fear to tread, but unfortunately you're not in Georgia, you're in Washington. And the reason I mention that is that the question of how you protect the One Health segment of the CDC budget and what people in this audience can do. Who is it that is the lead in the administration, but who are the leads in Congress that need to be told how important this issue is in terms of budgetary requirements?
So the question is, who in Congress needs to be told how important One Health is in terms of budgetary requirements? I say anyone who will listen. No, but there has been a One Health bill that's been proposed. There are rumors that it may be proposed again in the future. There's talk about it on the Hill, so that's important to recognize.
I'll just piggyback on Dick's question before we wrap up. Is there anything, Casey, that you would mind offering our audience in terms of reacting to? I imagine a lot of people in this room may talk about One Health and share it within their different networks and communities, but the response that if One Health is everything, then it's nothing, is more common than I'd like to admit. So as we leave and tonight with these great lessons learned, is there something that you could share with our audience that would help us not only respond to that, but make One Health seem more of a concept that's graspable and encouraging versus overwhelming?
Yes, and that is one of the exact reasons why we felt it was important to have what's hopefully a relatively simple infographic on what One Health is, who's involved, the importance of coordinating, collaborating, communicating, and what the ultimate outcomes are. And I always say that you can turn anything into a One Health issue. That's easy to do, but the key is to focus on something. You pick your topic, you pick your partners, you use that One Health approach, you start small and you build over time, and that's the key to success with One Health. So it is a challenge, but when people will say One Health is too broad, it means everything, so it's not important. We give some key examples from different areas, not just zoonotic diseases, not just things like antimicrobial resistance, but talking about some of our disaster preparedness issues, opioid crisis, a number of other things where One Health is relevant.
Thank you so much, Casey. Please help me thank her one more time for her time. All right, I'll make a few announcements before I let you guys leave. Just really quick, our One Health Academy survey is out. So that will be posted on the website, but is in the meeting invitations. And we would love your feedback, especially with all the changes from the past year. So please, shouldn't take more than 3 minutes, 5 if you're feeling generous, to let us know some feedback that we can continue to make this experience beneficial for everyone. So consider that as well. Tanya Nichols is in the back there, and she is a Smithsonian Outbreak exhibit volunteer. She has let me know that they are looking for volunteers for the spring. So if you're interested in that, please connect with Tanya to find out more and share One Health in the Smithsonian. And last but not least, the upcoming event, there's a One Health in the 21st Century where you would have the opportunity to see Casey yet again. It's the Monday after Thanksgiving on the 26th in the afternoon, hosted by the Wilson Center, EcoHealth Alliance, and World Bank. And that will be at Ronald Reagan building in Federal Triangle. So that's a great opportunity with 2 panels to discuss the future of One Health. We'd love to see you there. I can share that information also on the website and through further communications, but definitely take that into account. And yeah, as I would just ask, grab any food you'd like to take on the way out. We're trying to be respectful of our time at 8 o'clock. Thanks to Mark and Amanda for being here. So if we can all move in that direction, that'd be wonderful. And thank you so much again, Casey, for being here. We're so grateful. And thank you all for making it through this weather. I know it's becoming more and more attractive to attend via webinar based on the outside. So thank you for those online that attended, and we look forward to seeing you next month. Thanks so much.